Certainly. Let's delve even deeper into heart failure, including advanced pathophysiology, detailed management approaches, specific case studies, psychosocial aspects, and recent research developments. Advanced pathophysiology of heart failure. Types of heart failure: systolic heart failure, or HFrEF, defined as an ejection fraction of less than 40%. The heart muscle is weakened and cannot contract effectively. Mechanisms often due to ischemic heart disease leading to myocardial damage and left ventricular dilation. Diastolic heart failure, or HFpEF, defined as an ejection fraction of 50% or more. The heart muscle is stiff and cannot relax properly to fill with blood. Mechanisms commonly associated with hypertension, obesity, and aging, leading to left ventricular hypertrophy and impaired filling. Compensatory mechanisms: neurohormonal activation, renin-angiotensin-aldosterone system, or RAAS. Compensatory mechanisms activate to retain sodium and water, which can initially help maintain blood pressure but ultimately leads to fluid overload. Sympathetic nervous system activation increases heart rate and contractility but can lead to further myocardial damage over time. Myocardial remodeling, structural changes, hypertrophy, dilation, and fibrosis of the heart muscle occur in response to increased workload and stress, altering the heart's structure and function. Comprehensive diagnostic approaches, clinical evaluation, detailed history, assessing for risk factors such as family history, previous heart conditions, and lifestyle factors like diet, exercise, and smoking. Physical examination, evaluation for signs of heart failure, including jugular venous distension, or JVD, which indicates increased central venous pressure. Pulmonary crackles suggest fluid in the lungs due to congestion. Peripheral edema, swelling in the legs or abdomen due to fluid retention. Diagnostic testing, laboratory tests, B-type, natriuretic peptide, or BNP. Elevated levels indicate heart failure and help differentiate it from other causes of dyspnea. Complete blood count, or CBC, to check for anemia or infection. Electrolytes and renal function tests. Monitor for abnormalities that can affect treatment. Imaging studies, echocardiogram assess heart structure, function, and ejection fraction. Doppler studies can evaluate blood flow across valves. Chest X-ray to check for pulmonary congestion and cardiomegaly. Advanced imaging. Cardiac MRI provides detailed images of heart morphology and function, especially useful in cases of suspected infiltrative diseases. Nuclear scintigraphy can assess myocardial perfusion and viability. Management strategies, lifestyle modifications, dietary changes. Diet, emphasizing fruits, vegetables, whole grains, and low-fat dairy while limiting saturated fats and cholesterol. Sodium restriction, typically reduce sodium intake to less than 2,000 milligrams per day to help manage fluid retention. Physical activity, tailored exercise programs, encourage regular, supervised exercise that is suitable for the patient's condition to improve functional capacity. Weight management, monitoring weight. Patients should weigh themselves daily to detect fluid retention early. Pharmacologic treatment, first-line agents ACE. Inhibitors such as lisinopril improve survival and reduce hospitalizations by blocking the effects of angiotensin II. ARBs such as losartan are used in patients intolerant to ACE inhibitors. Beta blockers such as carvedilol improve symptoms and outcomes by reducing heart rate and myocardial oxygen demand. Diuretics. Loop diuretics, such as furosemide, are used for managing fluid overload, helping reduce symptoms like edema and dyspnea. Advanced therapies, mineralocorticoid receptor antagonists, or MRAs, such as spironolactone, reduce morbidity and mortality in heart failure patients. SGLT2 inhibitors, such as empagliflozin, are emerging as beneficial in heart failure management. Device therapy. Cardiac resynchronization therapy, or CRT. Used in patients with heart failure and left bundle branch block to improve synchronization of heart contractions. Implantable cardioverter defibrillator, or ICD, indicated for patients at high risk of sudden cardiac death due to life-threatening arrhythmias. Case studies. Case study HFrEF patient presentation. A 65-year-old male presents with shortness of breath, fatigue, and ankle swelling. His ejection fraction is measured at 35%. Management initiated on a regimen including an ACE inhibitor, beta blocker, and loop diuretic. Follow-up echocardiogram shows improvement in heart function over 6 months. Case study HFpEF patient presentation. A 72-year-old female with a history of hypertension presents with exertional dyspnea. Her ejection fraction is 60%, but she has significant left ventricular hypertrophy. Management. Focus on managing hypertension, lifestyle modifications, and diuretics as needed to control fluid retention. Heart failure can significantly affect a patient's mental health, leading to anxiety and depression due to the chronic nature of the disease. Involving family members in care and providing access to counseling services can enhance coping strategies and improve overall well-being. Research into gene editing techniques that could potentially correct underlying genetic defects causing cardiomyopathies is ongoing. Tailoring treatments based on genetic and molecular profiles of patients to optimize therapy is another promising avenue. Additionally, the development of wearable devices that monitor physiological parameters continuously is providing data that can help manage heart failure more effectively. Community initiatives aimed at reducing the prevalence of heart failure through education about cardiovascular health lifestyle changes and early intervention for risk factors are essential. Implementing routine screening for risk factors in high-risk populations to facilitate early detection and management of heart failure is also crucial. Heart failure is a complex, multifactorial condition requiring a multidisciplinary approach for effective management. Understanding its pathophysiology, comprehensive diagnostic strategies, and tailored treatment plans are essential for improving patient outcomes. Ongoing research and advancements in technology continue to enhance our understanding and management of heart failure. If you have specific questions or areas you would like to explore further, please let me know.